our, our honorable speakers, students, and teachers. Well, you are all familiar with the cancer. We all know that it is a very dangerous disease and is the second, I would say, uh, enemy as far as the death is concerned of the human race. About a crore of people die every year, and United States is the most affected country. A thief met with determination. I had a very close friend. In 2008 or 9, I wanted to have him in the faculty. He told me that he's suffering from lung cancer. It's very recently he passed. And the main reason was, firstly, the early detection that he could live with lung cancer. And the second was his own willpower. I've also known cases where, these days particularly, with this blood cancer, people are becoming victim of the COVID. These days, if somebody is suffering from COVID, or if he is suffering from blood cancer, if there is COVID, then there is no escape. Death is sure. So, friends, will be more a listener than to say what cancer is. But I can only tell you from my experience, uh, the people can live if they are knowing the disease early. And especially among the women is the breast cancer, in the men is the prostate. Then the blood cancer is also very common. And there are several things which are linked with the cancer. You are all students of life sciences. You all know that when the cells get disorderly, they do not care for the command of its division. They start growing of its own, and then even ask, give symptoms and signals to the blood vessels. Uh, all those things, these become devastating for the human body to bear that. So, with this introduction, I would be staying with you for the whole lecture, and rather, I would learn what you want to say. I would say the topic is very timely, very important. In the universities and institutions, more researches are required, so that are even awakening the people, or that the cancer disease can be controlled. We have in our faculty Dr. Poonam Nanda, whom I call as a very warrior, and she has fought with this. She is a living example. Just now you have shown us the video of Yuvraj Singh, the cricket player icon, and he talked about, because he's related with Poonam, he was talking referred to Poonam as Basi, and uh, that work that Poonam is doing for the cancer awakening that cannot be described in words. We are so that is a lesson for others also, that with willpower and to be happy and all these things, the gap can be narrowed down. This is your topic. Thank you very much for asking me to say something. I have said, wish you all the best. God bless you.
Thank you so much, sir. It's always a pleasure to hear you. So now I would like to request our respected Dean, ma'am, Professor Anuradha Surirajan, to express her views regarding the World Cancer Day and finally to introduce our experts for their talks. Over to you, ma'am.
Okay, thank you, Dr. Nitika. Honorable Chancellor of Shoolini University, Professor P.K. Kosla, our expert guest speakers, Dr. Sachin Gupta, Max Hospital, and Dr. Niladri Das, Postdoctoral Fellow, Stanford University. My dear students, my fellow colleagues, I welcome you all to this expert talk series today on World Cancer Day. So the World Cancer Day is being celebrated on February 4th every year with a unique theme. Dr. Nitika has already explained about the theme. And we all are aware as students, as citizens, as a public level, that how much cancer is come into all of our life, that every one of us know how dreadful the disease is. And it is a disease which develops from our own body's defective system, which is nothing but uncontrolled cell division, where our cells, which are going to divide in a controlled fashion, lose the control and start dividing in an uncontrolled fashion. Of course, the entire world is working towards solving cancer, but the only big challenge with cancer is that we are dealing with our own cells, making the treatment, the therapy, and the post-therapeutic effects being a big challenge to solve. So with these words, now I also like to invite you all for this talk and tell you all about Shoolini's efforts. So as already mentioned by our Chancellor, Sir, Professor Kosla, about the UV CAN efforts, which has been driven by our Dean Student Welfare, Ms. Poonam Nanda. So we've been doing a lot of efforts for cancer awareness in tie-up with the UV CAN. And our student volunteers, they really do a great job in this. I can also see Vipul from the sprint team who's actively also involved in this. And I would like to talk about the research aspect over here, what Shoolini is doing. So we have been into cancer research since inception. So I come from IISc Bangalore PhD and a postdoc from National Cancer Institute of NIH USA, where I've done research related to cancer. And again, seeing the problem and how world is suffering. So I'm continuing the cancer research here. We have a lab here which works on cancer biology, where we are actually trying to explore the medicinal flora of Himalayan region and even the microbes of the Himalayan region for anti-cancer molecules. Now, you all know that getting into therapeutic level is a very challenging job. That if I start looking for a drug now, it's going to be 3 decades, more than that. As medical doctor, Dr. Sachin would be knowing that it's not easy to get a drug to be passed for clinical use directly. So that is a challenge for the journey as well. We are contributing in terms of the drug discovery. We collaborate and look at molecules from plants for looking at anti-cancer activities, validate them in cancer cells. And we have seen several leads from the Himalayan plants. And this work has also been funded from DBT, which has given us grants to do cancer research. And Shoolini University, to have a holistic effort towards cancer research, has developed the Raj Kosla Center for Cancer Research. So this is a center developed with the endowment of Raj Khosla sir, who has been kind enough to promote cancer research. And this center is trying to enforce and make sure foster research on cancer from Shoolini, so the Shoolini can contribute towards the cancer treatment and cancer overall cancer research. Whether you talk about prevention, whether you talk about food for cancer, whether you talk about medicine, therapeutics, or taking it to the society in terms of cancer awareness. So this is the efforts of Shoolini University towards cancer research, and globally, this effort is going to play a major role in UN Sustainable Development Goal towards health. So we are trying to do a lot of things in coursework as well to have cancer biology. Recently, we have introduced PhD in cancer biology from this year. We have 2 students who have joined here also for PhD program here. So that's about the cancer research which we do at Shoolini, and definitely we look forward to contribute a major kind of inventions towards this particular cause, which is a major cause in India as well. And so sir talked about US being the number 1, which is suffering, and India is slowly coming up. And even in the Indian data, Himachal has actually come on the top if you look at the 45-year age above group. So general surveys have shown that the numbers are highest in Himachal state-wise, if we look at, in terms of number of cancer incidents, whether you talk about malignant tumor or general cancer incidents. So really, more than the COVID pandemic, which we are all going through, the cancer is an ongoing pandemic, I would say, which has been there with all of us. And we have not been still able to reach there, mainly because of the expenses related to this treatment. And that's how this World Cancer Day has been actually themed with closing the gap in care. So basically what they try to says that we should be doing some actions to identify what are the challenges. Now, if a poor man who is actually below the poverty line, if somebody in a BPL range gets a cancer, so how do they get a treatment? So we all know that when moment we talk about cancer treatment, how expensive it is. So these are the challenges which this World Cancer Day is trying to address. And year 1, they've tried to look for identify the challenges, and then raise the voice to the higher level, go to the government, go to the nation level, even go to the United Nations level, and then raise maybe funds and make more affordable cancer cure. where I think our clinical doctors like Dr. Sachin would be definitely required. Their efforts will help us for getting a more affordable cure for cancer. So with these words, now I would like to welcome our expert, the first speaker of our day, Dr. Sachin Gupta. So Dr. Sachin Gupta is currently Associate Director of Medical Oncology and Hemato-Oncology at Max Super Speciality Hospital, Mohali, Punjab. So he has done his MBBS from Government Medical College, Patiala, Punjab in 1998, following which he has done his MD from DMC, that is Dhanand Medical College, Ludhiana. After his MD, he has extensive experiences in medicine, which includes Dhanand Medical College, Rajiv Gandhi Cancer Institute of Delhi, Artemis Health Institute, then Medanta Cancer Institute at Gurgaon, and currently he is associated with Max Hospital as an oncologist, and he has contributed a lot towards medicine for cancer, and he has won several awards, the key one being the Rashtriya Gaurav Award for cancer. And he has also done a lot of work I would say related to research, which I could understand from your CV, sir. With these words, I would like to welcome you, sir, to give you a talk on cancer awareness, diagnosis and treatment. Thank you, sir, and welcome.
Namaskar. I hope I am audible and visible.
Yes, sir. Yes, sir.
Yeah.
Yes, sir.
Thank you, Nitika. And at the outset, I would like to thank Shoolini University and Chancellor Sir Shri Kosla ji and Madam Anuradha for having me on board for this special event, and which is the need of the hour. And thank you, Shoolini University, for taking your time out and for making all this effort to bring about this awareness, which is very much required. And so I would in next 15 minutes or so, and I would like to highlight certain things, and which would cover a lot of aspects about cancer, which would be regarding symptoms, regarding diagnosis, screening, and treatments available, what is happening latest in this field. And I would also like to congratulate Shoolini University for doing research on cancer, which is actually very much required, and for which I can say that it is not that much happening in our country as required. The need is huge, but the efforts are not matching up. So since you are doing this effort, which I was not aware about, so I really congratulate you that you are doing basic research, and especially about the medicinal plants which exist in our country and in Himalayan region. So which is very, very much required actually. So many, many congratulations on that. And so to begin with, and so as you have already set the stage, Madam Anuradha and Kosla sir has already said few things which are very valid and relevant, that cancer incidence is huge, and it is one of the leading causes of morbidity. Morbidity means that the problems and the disease symptoms, effects which the patients are suffering from, and also mortality, that means death. So both these things, cancer is a major contributor, and along with it, it's a huge economic drain on the patient and the family. So it's not only a physical ailment. Cancer is actually a social, economic, functional, and it has many, many aspects, because once the patient is diagnosed with cancer, it is a very devastating experience for the patient and the family. And it comes at a huge personal cost, relationship cost, financial cost, loss of employment, loss of dismemberment, handicaps, because a lot of organs get dismembered, disorganized because of the treatments, surgeries, radiation, chemotherapy. So the cost is actually huge, and rehabilitation is very difficult. And so the early diagnosis and prevention is one of the very important aspects. So to begin with, we have, I will just enumerate few symptoms for the audience. And so mainly the cancers may, is English okay, or should I speak in Hindi also for, is that?
It's okay, sir. English is fine.
English is fine with everybody? Okay, that's fine. So the main symptoms in cancer may be the presence of a lump. So any, mass, soft tissue mass may happen, like lymph nodes in the neck, a lump in the breast, lump in the abdomen, in the inguinal region, in axilla. So in all these areas, so there can be lymph nodes and lumps. So for especially for breast cancer, a lump may be the most common presentation. Then if we start from head to toe, then the head and neck cancers are very common and one of the major incidents of cancers in the country because of tobacco consumption and BD and cigarette smoking. So any ulcer which is not healing in the throat, in the tongue, lips, oral cavity, cheeks, and change in voice, difficulty in swallowing, and any bleeding from the throat, nose. So these may be symptoms of cancer in the head and neck region. And then food pipe cancers would mainly present with the difficulty in swallowing. So the food may get stuck in the food pipe and the patient may have loss of appetite and loss of weight. And stomach cancers would present again with loss of weight, loss of appetite, especially in middle age, new onset indigestion if happens. So that needs to be addressed with an endoscopy. Breast cancers, as I said, will present with a lump in the breast or in the axilla, and also changes in the skin and retraction. The nipple may, get entrenched inside, go inside, which we label as the retraction of the nipple. So if any change in the skin, change in the nipple shape, size, or retraction, so that may be a symptom of breast cancer, and the incidence increases with increasing age. So in the younger people, the breast lumps may be benign, but no age is totally immune because as specialists, we see a lot of young people also suffering from all kinds of cancers. And lung cancer is again a very important cancer and very high incidence. It's number 1 and 2 cancer in most of the registries. And so smoking is again the main reason. So tobacco consumption, and we as a society needs to put our effort to ban this. So the tobacco and the smoking things are a major source of revenue for our governments. So they are not, they don't want to discontinue and ban these kind of poisonous things. So a societal pressure is very much important. And as students and as teachers, we all need to, make efforts to enforce this on our governments to ban such kind of poisonous substances, right? And so lung cancer patients would mainly present with cough, with the breathlessness due to fluid formation in the lungs, and there may be some blood in the sputum, and weight loss is another reason. Pain in the chest can be another symptom, and it can be easily diagnosed with x-rays, CT scans. CT scans are nowadays very commonly and easily available in most of the places and even smaller towns, and so they can be easily picked up, and later on we can do FNACs and needle tests, biopsies to confirm those things. And if we move a little down to abdomen, then we have organs like stomach, pancreas, gallbladder, liver, intestines. So these patients may present again with pain in the abdomen. And if the system is liver, pancreas, gallbladder, then jaundice may be a presentation. So yellowness of the eyes, etc. And for colon cancer, then constipation or blood in stools may be a symptom for colon cancer. That is large intestine, right? So this is again a common cancer in our country. And low down we have female organs like ovaries, uterus, and cervix, which are again a huge load of these in females. So cervix is number 1 and 2 cancer again, along with breast, and ovarian cancer is number 3, uterine cancer is number 4. So these cancers are female specific, and again very common in our country and all over the world. And they may present with the distension of abdomen, fluid formation in the abdomen, and bleeding apart from menstrual cycles. So that may be a symptom for CS cervix commonly. So any bleeding which happens in females who are post menopause age is again, a cancer must be ruled out. So a very common thing. So after menopause, there should be no menstrual bleeding. So if any bleeding happens, that's cancer is one of the main diagnoses which needs to be checked and ruled out, and it can be easily done by gynecologists. So, and for prostate cancer in men, difficulty in urination, and so the decreased flow of urine, or going for urine again and again. So these are the common symptoms, and prostate cancers can be picked up by screening with the help of a blood test called as PSA. Right, it's a blood sample, and again commonly available, easily available, not very costly also, within maximum few hundred rupees. And so yearly PSA can be done by men. And for cervix cancer, there is a pap smear test in females, which is recommended yearly for females who are married. So because this spreads due to a human papilloma virus infection of the cervix, and over a period of time, this HPV virus can bring about changes leading to cervix cancer. And we have a few vaccines available for human papilloma virus, which can help in decreasing incidence of CS cervix. So in Western world, CS cervix incidence is very low. It's hardly there, and in our country and in the uh, developing countries and underdeveloped countries, the incidence is high, as is it is related to virus infection, and also hygiene issues are there. So this can be prevented by vaccination, and these vaccines are again commonly available, and they cost about few thousand rupees, not very costly, but it is not under the national immunization programs yet, right? And so breast cancer is also we can do screening by mammography. Mammography means the X-rays of the breast and ultrasound of the breast, MRI. So mammography again is not very uncommon, quite commonly available in most of the diagnostic centers and radiology centers, and also district hospitals and medical colleges. So these things are very easily available. So these can be again done. So screening for breast is recommended after age of 40. So the breast cancer, the cervix cancer, and prostate cancer, and also the colon cancer, for which we can do stool test for looking for the blood in stools to find out if any leakage of blood is happening from colon cancer ulcers. And colonoscopy, which is little cumbersome. So colonoscopy is that the camera with a tube which we can put through the food pipe or through the anal canal, and see the large intestine. So these tests are little costlier and cumbersome, so difficult to do in screening, but it is still recommended that after age of 45, 50, colonoscopy can be done every 10 years. But again, it's difficult to do this as a community program, because the effort required is too much in this. And so if any symptom is happening, then it's the duty of the patient as well as the doctor to do early testing. So depending upon the symptoms, depending upon the organs, so endoscopy or X-ray or CT scan or MRIs, PET scans, FNACs, biopsies, so all these things are available in most of the centers, medical colleges, district hospitals, and of course specialized cancer centers are there to handle whenever the patient is referred to us. And so nowadays the diagnosis, we can do biopsies, and on biopsies there are special tests which can be done, like immunohistochemistries. And we nowadays we can go to the extent of doing next generation sequences, DNA, RNA studies, and so we can find out the genetic changes also which have led to the cancer formation. So about 5 to 10% of the patients are because of the genetic and the hereditary, this transmission may be there. But in rest of the majority of the patients, the cancer just happens because of various issues. And the various issues can be lifestyle issues, it can be smoking, it can be tobacco, it can be chemicals, it can be because look, our soil is poor, polluted, our air is polluted, we are using so much of pesticides, insecticides. So a lot of chemical changes have happened in our environment in last 50 years or so. So the green revolution and the white revolution, so all kind of the progress we have made in other fields have led to a lot of pollution being increased in our environment. And of course, as we are on the top of the food chain, everything comes to us from the soil, water, air. It gets concentrated in our food, be it vegetarian, be it non-vegetarian. And ultimately, we are consuming all these chemicals. So that is one of the major thing which is leading to this. And so in lifestyle, so if we say breast cancer, then late marriages, less number of children, not breastfeeding, and obesity, lot of this being fat and a lot of fatty diet, so that again increases the incidence of many kinds of cancers. Alcohol consumption is again a very important factor for this. Along with this, we have, one thing which is not given much importance is the stress and lifestyle. So all of us has stress, and we need to develop techniques, learn meditation to manage stress. So we cannot eliminate stress, we can manage stress. And last but not the least, our relationships and lack of love. So this is not written in any book, but this is my experience, and being in spirituality also along with this, I always explore the reasons, and I find that the main reason for any kind of illness and everything is actually lack of love. So we have problems in our relationships, that relationship problems, lack of love, hatred, grudges, guilts. So all these things are bringing about a lot of changes in our energy system. So behind our physical body, we have a chakra system, we have energy flow. Those things are not taught in the medical school, not taught to doctors. But these things behind our physical body, there is a subtle astral body, and this energy system is there, which gets damaged. There are blocks, and I sincerely hope that the medical community as well as everybody else, focuses on this and do yogic exercises, pranayams, breathing techniques, meditation, to handle our stresses and to bring about good flow of our energy system, so that these diseases don't develop, don't arise. So as was said in the beginning, that we have immunity, and cancer cells keep on developing in the body, but our immunity checks those. Immunity cells would kill cancer cells in the body, but if the immunity goes weak, then the cancer cells would get a chance to develop. So how to strengthen the immunity? That is by consuming good organic diet, fresh air, exercise, and being managing stress and being happy and being loving. So we have to develop that unconditional love and spread love to our family members, our relationships. Then we can be supremely happy and healthy also. Yeah, all these things are interlinked. So there is a neurohormonal immunity axis, endocrine axis. Hormones are playing role. Relationships go wrong, hormonal imbalances, immunity goes down, and cancer develops. So one thing cannot be isolated from the other things. All these things are interrelated to each other, right? So I lay a strong stress on stress management uh, and relationships being healthy, meditation, to handle all these things. So meditation gives us strength to handle all these issues, right? And another important aspect would be organic food. So we have ourselves started, I have started an organic farming community where we have hired 4 acres of land, and we are growing our own organic vegetables for the member families. So all of us can, do things like that, develop our kitchen gardens, rooftop gardens for kitchen gardening, and growing our own vegetables. So a small steps also would be very helpful in, in getting good organic diet for ourselves. And so coming to treatment, we have a lot of advances beyond chemotherapy. We have now targeted therapies, immunotherapies, and so we find targets on the surface of cancer cells, and there are medicines available to attack on these targets and to avoid side effects to the rest of the body. So to give you an example, we have one tablet a day for a chronic cancer like CML, chronic myeloid leukemia. It's a type of a blood cancer for which we have oral targeted tablets available. Similarly, lung cancer is a very dreaded disease with very high morbidity and mortality. But one kind of lung cancer where we find targets, adenocarcinoma with EGFR mutations, with ALK mutations. So these kind of lung cancers again can be treated with just one tablet a day. So the treatments in my own journey as a cancer doctor, I have seen in last 15, 20 years that the advances are immense. The research in this field is immense. But the cancer cells are also smarter. After a while, after a few months, after a few years, they also develop ways and mechanisms to survive, to avoid attack from the drugs we are developing. So a lot has been done, but immense needs to be done further. but we have the idea is we should not lose hope. If we can always do something for the patient. If the patient comes in late stages, again we have treatments available, and with the play of chemotherapy, with the targeted immunotherapies, and of course if nothing else can be done, at least some support, some loving care can be done to comfort the patients. So that always is available with us. But if we are able to catch it early, in early stages, then of course cures are also possible. So we should not get disheartened, don't lose hope, but we should spread awareness as we are doing today, so that we catch this disease early. That is more important. So I think this was all I wanted to say in nutshell. In brief, I have covered a lot of aspects, and I'll be happy to answer a few questions if any.
Thank you so much, sir, for this deeper insight. And finally, I think students who are working on cancer and its cure. So I think Gopal has a question here. So from clinical perspective, how close are we in unlocking an ideal therapy to overcome mortality? Or how far are we from it? And what is the cost?
Yeah. So that's a very relevant and valid question. So as I just said that we have few targeted therapies available. Not few, but we have now many 50 to 100 targeted therapies available already with us. So many molecules are there. And so these are mainly coming from researchers in North America and Europe. And but we have few good pharma companies which can replicate those drugs, but we are not coming up with original molecules as such. Lot has been done, but there is a huge number of patients, huge types of the number of cancers. So like I said, we have targeted therapies for, let's say, breast cancer, for lung cancer, for colon cancer, for head and neck cancer, for CML, but there are so many other cancers for which we have nothing. And again, these therapies are increasing the lifespan. They are trying to control the disease, but we are not curing our patients, especially in advanced cases, right? So we need to find more such targets all the time. And when these cancer cells develop more mechanisms to evade these drugs, then newer targets need to be found, and how to overcome those the cancer resistance which the cancer cells develop. And the time would come when we are taking a blood sample, we are finding out there are circulating cancer cells, we find which targets are there on the cancer cells, and a field of personalized precision cancer medicine is emerging up. So where we find out that what exactly is wrong with this particular patient in this particular cancer, and what kind of cancer cells there are, and we give medicines which are actually suiting to the targets of cancer cells in the patient in which the sample has been taken. So that would be a personalized cancer care, and this is not very far off. In few years time, in decades, in next 2 decades, lot of new things are happening, and already with targeted therapies and immunotherapies, lot of changes have already happened. But believe me, with everything we do, we are not going to be immortal ever. We, the human, the mankind will keep on facing new challenges, as we have seen in last 2 years. And suddenly this COVID was there and we could do nothing. And still there is no medicine for COVID. It's a virus, it comes and goes of its own after attacking us. So the challenges, newer challenges will keep on coming. And as the human nature is here, we'll keep on fighting and keep on developing newer things. That is what we should strive for. And whether we are winning this war or whether we will win this war, I'm not the person who can answer this, but our efforts will always keep on happening for many centuries to come, right?
Thank you so much, sir. So we have another question from Vanchika, that how our daily practices or lifestyle habits can increase or decrease the chances of developing cancer. Can some specific foods cause or prevent cancers?
So nature has given us all kinds of colored fruits and vegetables which have lot of protective chemicals. The problem is that the food itself, as I just said, because our soil, air, water is polluted, the food itself is containing chemicals which are harmful in the form of pesticides, insecticides, fertilizers we are putting in the soil. So we should try to turn organic as much as possible, do regular exercises to keep our body fit, avoid being obese. Obesity is a risk factor, and of course the stress factors which I have already explained. So these 3 4 things everybody should strive to bring about changes. And good sleep, adequate hydration, good amount of water intake. So sleep is another thing, and in the fast paced life, the way we are eating, the quantity of food we are consuming, the time of eating, the and whether we actually need to eat at that particular time when we are eating. Sometimes we are just eating because it's time to eat without even feeling hungry, and that extra calories we are taking all the time, the sweet dishes we are consuming, and the junk we are consuming. So all these things are important. We need to do everything in moderation. And of course, I don't say that life should be totally dry and without any spice. So once in a while you should have a cheat junk food diet day, and which is pretty okay for everybody. But in most of the times we should be consuming good organic diet. And I am personally a vegetarian, and so that is I would vote for. But it's okay whatever food preferences anybody has.
Thank you so much, sir. And thank you for your time, valuable time. Sir has many sessions like that is being related to cancer awareness, and his talk is being scheduled. So thank you so much, sir.
Thank you.